Good morning, everyone. Thanks for joining us on What to Know Wednesday. I'm Susan with Indiana SHIP, the State Health Insurance Assistance Program, and I'm joined by my colleague in Northern Indiana, Megan Rogers, who's going to talk to us about enrollment periods today. Good morning, Megan.
Morning, Susan. How are you today?
I'm doing well. I'm hoping we get a little snow, but not too much snow today.
Well, I'll be sure to send our snow down your way.
Oh, yeah. Well, no, no. You keep that lake effect stuff up there.
All
Anyway,
right.
just wanted to remind people that if you're joining us live, you can chat in your questions or comments for Megan, and I'll be monitoring that on our Facebook page. If you're watching this as a recording on Facebook or on our YouTube channel, still ask us questions. Just write them in because we do monitor both of those and we'll respond to you. There's also ways you can connect with SHIP to ask us about all your Medicare questions, including enrollment periods. And that's in our toll-free number, and I will put that in the chat as well. So, without further ado, Megan, what's up with Medicare enrollment periods?
All right. One of the biggest myths out there, at least I think, is that, hold on, I need to go back and change something, is that you cannot make changes to your Medicare every single day um, of the year. You have to be in certain phases to make those changes. And a lot of people don't know that. So it is a very important piece of Medicare to be aware of. So we're going to go through all of the enrollment periods out there on what they are, when can you make changes, and what type of changes. So this is the list of the enrollment periods that we're going to go through. There's your initial, so when you're new to Medicare, general, special enrollments, the fall open enrollment, your supplement Medigap open enrollment, and advantage plans. All right, so initial enrollment period. So again, this is when you're new to Medicare. Um, so there's two ways that you'll be enrolled in your Part A and Part B. Automatic versus not automatic. So if you are becoming eligible for Medicare, and you receive Social Security income. So you get a check deposited from Social Security every month for whatever reason, then you will automatically be enrolled in Medicare 3 months before your Medicare starts, and you're going to get that card in the mail. If you are not receiving any kind of Social Security income, you do have to initiate the process. So generally 3 months before you're going to become eligible for Medicare, you want to contact Social Security to get your Medicare started. Unless you're going to be delaying it because of work insurance, either through your employer or your spouse's employer. So there's three enrollment phases. Susan, I can't talk today. I think the snow's got my head all rattled. Okay, let me refocus on Medicare. There's three main reasons why you would get Medicare. You're turning 65. You've been on Social Security disability for 24 months, and you're going to get your Medicare on the 25th month, or end-stage renal disease of any age. So when you do become eligible for Medicare, you get a 7-month enrollment phase. 3 months before your birth month or the 25th month of disability, and the 3 months after. If you enroll in Medicare 3 months before your 65th birthday month, your Medicare will start the first of the month. If you decide to have your Medicare or enroll in your Medicare in your birth month for any of the 3 months after, it will start the first of the month after you enroll. It always starts the first of the month. Now, Susan, I'm going to quiz you. If my birthday was March the 1st, when does my Medicare start?
Well, Was as in last March, or you'll be 65 this March?
This March, the
Okay.
1st.
If your birthday is March 1st, you get a bonus month of
Woo-hoo!
Medicare. So it would start on February 1st.
Exactly. Susan gets a gold star today. So that's just one of the fun pieces of Medicare. If your birthday is anywhere from the second of the month to the last day of the month, it will start the first of that month. But like Susan said, if your birthday is the first of the month, your Medicare is going to start the first of the previous month. Why? I
Megan,
don't know. Susan, yes.
my birthday's January 31st. When will my Medicare start?
January the 1st.
I kind of get a bonus month too.
You do. You do. I didn't think of it that way, but you do. Yes.
Yeah.
I teach a 10-week Medicare class every fall and every spring in St. Joe County. And one class, or one, I think it was a spring a couple years ago, I had 6 individuals in that class, and 4 of them all were born on the first of a month. It was crazy. But it was a good thing to teach them and let them know, hey, you're going to get a whole extra month. All right, so this is your initial enrollment period. When you are applying for A and B, you apply through Social Security. So either online, going to their office, or a phone appointment. And if you do go to the office, you have to schedule an office appointment as well. All right, our next one, general enrollment. I tell people it's a good enrollment period that we have it, but you want to avoid it. Your goal is not to have to use the general enrollment period. So this enrollment period happens every year from January 1st to March 31st. And it's for people who missed their initial enrollment period and did not delay their Medicare because they had employer insurance. This is for individuals that delayed it because you had VA coverage, marketplace, or no insurance at all. And you either decided you didn't want to take Medicare when you were first eligible, or you didn't know you had to. So let's say we've got George. George turned 65 in the fall. He didn't have insurance. He didn't want Medicare, so he didn't sign up for it. Well, 5 years have passed. George is now 70. And he calls us, and it's in July. And we say, well, George, you don't have employer insurance, and you are no longer new to Medicare. You're out of your initial enrollment period. So, George, you can't get Medicare now until the general enrollment period, starting in January. George says, okay. George calls Social Security in January and says, I want my Medicare now. Well, George is going to be told a couple different things. He's going to be told, sure, we're going to sign you up with your A and your B, and your Medicare will start the first of the following month. So George will get Medicare February 1st. And he can get his other pieces, his drug coverage, his supplemental advantage plan. Social Security is also going to tell George, unfortunately, you're going to get a penalty. And that means that George is going to have to pay a higher premium for his drug coverage and his Part B for the rest of his life. So for Part B, it's 10% for each full 12 months you were eligible for Part B and did not enroll and did not have employer insurance. So George delayed his Medicare 5 years. So he is going to have a 50% penalty. The Part B premium this year is $202 and 50 cents. So George is going to have to pay the 202 plus an additional 50% of that. So 101 on with 202. So I think if I got my math, that's 303. Sound right, Susan? She's nodding her head and laughing at me. So that's what George would have to pay for his Part B because of that penalty. He would also have to pay a penalty for his Part D if he also delayed that as well. And that's 1% for each month you are eligible for typo D, not B, and did not enroll. So it's going to be 33 cents for each month, 33, 34 cents. It goes up a little bit every year. So it starts off slow or not as a very high penalty, but after it's been a few years, that monthly 30 some cents is going to add up very quickly. So don't be like George and don't have to use the general enrollment period, but it is important you know that it's there and that you know you need to avoid it. All right, now we have special enrollments. So this special enrollment is for your employer coverage for A and B. So if you did turn 65 and you or your spouse have employer insurance and you're on the employer insurance, you can delay your Medicare A and or B penalty free. And we have some other Zoom presentations that we did going over the specifics of that. But when you are eligible for Medicare, you can decide to delay your Medicare because you have employer insurance and you like that employer insurance. And when you are delaying your Medicare for that reason, you are in one continuous enrollment phase. So if you decide you don't like your employer insurance anymore, you can drop that when you're able to, and you can get signed up for A and B. Most people, though, wait until they retire or lose that employer insurance. And when you do lose that employer coverage, you have an 8-month special enrollment to get your Medicare set up. Now, most people do want their Medicare to start the day after their employer insurance ends. But if for some reason, maybe your employer insurance was extended a little bit after you stopped working, or you went on COBRA for a little bit, you have 8 months to get your A and your B set up through Social Security. Now, there's a Medigap special enrollment. So you have your A and B set up, and you've decided that you're going to get a Medigap/supplement. Well, the first 6 months that you have your Part B, you get a special enrollment that allows you to get your Medigap with guaranteed issue. And guaranteed issue means that they won't look at your health history and you will be guaranteed to be sold a policy at the lowest possible premium for your age. If you waited till after that 6 months, let's say 8 months after being put on Part A, you decide to get a supplement, it's still possible to get a supplement, but they're going to do medical underwriting and they're going to look at your health history. So if you're relatively healthy, you wouldn't have a problem. But if you do have some chronic health issues, you could be denied a Medigap policy, or you may have to pay a higher premium. So there are a few other guaranteed issue periods throughout your lifetime to get a supplement without them looking at your health history. And when it comes to Medigaps, with a Medigap, you can pretty much sign up for one anytime you want. So when it comes to a supplement/Medigap, the guaranteed issue phase kind of replaces the other Medicare enrollment phases. So if you lose COBRA or a retiree plan that is secondary to your Medicare, you get 63 days of guaranteed issue to get a supplement. If your Advantage plan leaves Medicare, you get a special enrollment with guaranteed issue for your supplement. And then if you move out of the service area of your Advantage plan, you can either get another Advantage plan, or you would get a special enrollment for 63 days to get a supplement with guaranteed issue. Then there's a couple things called trial rights. So if you enroll in an Advantage plan for the first time when you're 65 or older, and within 12 months you decide that you don't want an Advantage plan, that you want to get a Medigap, you can drop that Advantage plan and you would have guaranteed issue, again, I believe 63 days to get a supplement. And then let's say you did have a Medigap slash supplement and you've had it a year, 5 years, 10 years, it doesn't matter. But you decide that you want to try out an Advantage plan for the first time. So you can cancel your Medigap. You can enroll in an Advantage plan if you are in an enrollment phase to get an Advantage plan. And within 12 months, you can drop that Advantage plan and go back to your Medigap plan. And they will reissue that policy to you without doing any kind of medical underwriting. So now we have some other special enrollment periods geared towards Part D plans and Advantage plans. So if you move, you do want to call your drug company or your Advantage plan and let them know where you're moving to find out if your plan is still available in that new area. And if it isn't, you get 63 days to pick another plan. If you have Medicaid and Medicare, you get additional special enrollments, and those are generally every month you can enroll into a new drug plan if you want to. If your plan leaves the Medicare program or reduces its service area, you're able to enroll into a different plan. And I have a few client appointments today, and they are all coming in for this reason. Their plan left Medicare at the end of December. They were not able to enroll in their new plans yet, so they're coming in today to see me to get those new plans set up. If you leave or lose employer or union coverage, you get 63 days for Part D or Advantage. And then this is one that can be very important to know about, and a lot of people don't or they forget. So if you enter a nursing home for rehab, you discharge a nursing home for rehab, or you live in a nursing home, you get special enrollments to change your drug coverage or Advantage plans. Some people, when they go in for rehab, they may want to get off their Advantage plan and go back to original Medicare to hopefully get some extra days for their rehab. Because sometimes Advantage plans are a little bit picky with that, and they would like you to discharge as quickly as possible. Now, my dad has been in a nursing home long term for 10 years now. He's been on Medicare for 8 of those 10 years. So for those 8 years, he has been in a continuous special enrollment period where if we wanted to or needed to change his plans, we could at any point. So just know that if you are in a nursing home, you enter or discharge a nursing home for rehab, and you're having some issues or concerns about your plans, you can reach out to SHIP and we can help you determine if it would be a good thing to change your plans or stay on the plan that you're currently on. Susan, do you got any questions for me?
Yes. What if you're in an Advantage plan
Mm-hmm.
and the provider leaves the network? Does that create a special enrollment period for you to choose a new Advantage plan so you can continue to see that specialist or other provider?
That is an amazing question, Susan. Thank you for asking that. Generally, no, unfortunately. Your provider leaving the Advantage Plan network or the Advantage Plan leaving the provider network is not a reason for a special enrollment or a given special enrollment. What you can do is if that happens and you are not in another enrollment phase at that point, you can call Medicare, 1-800-Medicare, and ask for a special exception. Sometimes they grant it, sometimes they don't. It depends on some of the other things going on surrounding that request. Now, 24, we had an Advantage Plan company leave the local medical office here in Plymouth, and it was in July. Well, there is no ongoing enrollment phase in the middle of the year. unless, you qualify for one of these special enrollments or you're new to Medicare. So individuals that were with that insurance provider were not given a special enrollment. Now, luckily, the contract ended up being signed, so individuals were able to stay with that insurance provider. We had a little bit of a panic, but it all worked out. Now, the following year, in January 2025, we had another insurance company drop the local medical provider, and that did not get resolved. That actually did become a situation where individuals had to leave that insurance provider or leave their doctors that they were seeing. Now, since it was January, and we haven't gotten to this enrollment phase yet, but January to March 31st is the Advantage Plan open enrollment, and that will allow you to change your Advantage Plan if you want to during that point. So that worked out in that situation. Individuals were able to switch to a different insurance company. Now, there is one new enrollment. Well, I don't really want to call it an enrollment phase, but a new special enrollment that will allow you to change if needed. So in 2025, during fall open enrollment, Medicare.gov added a new piece to it where you can type in your providers, and it will let you know if your providers take the specific Advantage plans available to you in your zip code. And if you pick a plan because Medicare.gov is telling you that your doctors take that plan, but then you find out that that provider does not take that insurance company, that Advantage plan, you do now get a special enrollment to change your Advantage plan because of that. So that is brand new, starting last year and implemented this year. Susan, did that answer your question?
It did. Thank you, Megan.
You're welcome. That was a very good question. Thank you for asking that. So fall open enrollment. I mentioned this briefly. So this is every year from October 15th to December 7th. And during this time, you can go from your current Advantage plan to a new Advantage plan. You can go from your current Part D drug plan to a new Part D plan. You can go from Advantage to Part D to Advantage. So you can make any of those changes. Now, if you go from Advantage to Part D and you're back with original Medicare and you want to get a supplement, that's something you can try to do, but you will not get guaranteed issue. So if you're relatively healthy, you shouldn't have an issue, but if you do have some health issues going on, some chronic health conditions, you may not be able to get that supplement. Your new policy will start January 1st of the following year, and you can make as many changes as you want. Now, I don't have a lot of clients that do that, but a lot of clients want to have this review over with and done with early in the season. So they will call and try to get an appointment early, October 15th, 16th, 17th, end of October. But then they still have several weeks of the open enrollment left. What happens if their medication changes or their health conditions change? Well, they can come back and review their plans again. And if we find a new plan that is better for them with their current condition or situation, we can enroll them. And whatever was the last plan we enrolled them into as of December 7th at 11:59 p.m., that is the plan that will start January 1st. So it can be helpful to make different changes if needed because we've got 8-9 weeks of fall open enrollment. And if you do your review early and something happens, your medicine changes, your health conditions change, then you can still make those changes. And I'll tell clients, whenever they come to see me, even if it's December 5th, if anything has changed with your medication, I need you to call me so we can do another quick review. All right, and I touched on this one as well, the Advantage Plan open enrollment, and that's what we're in right now, January 1st to March 31st. So if you start the year on an Advantage Plan, you can partake in this enrollment phase. You can go from one Advantage Plan to another. You can go back to original Medicare and enroll in a Part D plan. Again, no guaranteed issue for supplement/Medigap. You can only make one change during this enrollment phase, and the plan that you go into will start the first of the following month. So very quickly, everyone, that was our enrollment phases that you get when you are on Medicare. If you have questions or need help seeing if you are in an enrollment phase, you can call us at our call center, 1-800-452-4800. You can go onto our website. You can chat in, and like Susan said, we will reach out to you if we see a question or a comment, or if you Facebook message us, and we can help you navigate all these enrollment phases and help you to know what you can do or can't do during the phases. Susan, any other questions?
There are no questions in the chat box.
Wonderful. So, Susan, I'm going to turn it over to you to share what we have coming up.
All right. Well, there's still some of January remaining. And we have one more Medicare Monday, and that's coming up on the 26th. And it is always a lot of fun, really interesting, and super important for everybody to figure out and find out what's going on out there in the world of fraudsters. And we're going to be joined by our special guest, Barb Miller from the Senior Medicare Patrol, where she is extremely knowledgeable about current Medicare fraud. And then she also will share about other frauds that are going on that are timely. We're coming up on tax season soon, and so there's always some tax frauds around, and Barb will be able to tell us about those kinds of types of fraud too, to protect yourself. And remember, don't answer your phone. I'm sure she'll tell us that several times. But join us at 10 a.m. Eastern Time, Monday the 26th, and we'll talk with Barb and find out all about fraud from her. Then in February and March, we have two more Lunch and Learns scheduled, and that's going to be February 12th. And we're going to talk about options for coverage. In addition to your Medicare, what else can you get? Most people don't just fly with original Medicare Parts A and B because there's a lot of out-of-pocket costs that Medicare doesn't cover. And so most people either choose one product or another, depending on their preference and situation. So we're going to talk about all the different options for coverage along with your Medicare. So mark that in your calendar. That's a Lunch and Learn. So that's noon to 1 on Eastern Time on February 12th. And then in March, we're going to talk just a general. What is Medicare? So tell your friends who are thinking about getting on Medicare, or maybe they're caregivers for people who have Medicare. Please join us for that Lunch and Learn session.
Thank you, Susan.
You're welcome.
Well, thank you everyone for tuning in and watching. Let us know if you have any questions, and we will see you back here with Barb Miller on the 26th.